Welcome. This is, I think, our 7th or 8th Monday Zoom meeting. And Ray and I have been putting these on as much for ourselves as for everybody else. It gives us some peace, just knowing that there are a lot of people out there going through the same thing that we are. And that's one thing that we have in common. We all have this in common. We're all going through some sort of a reaction to what's going on in the world, something that we can't control. Our guest today is Todd Williams, and Todd Williams I met about a year ago at a speakers network out in Kansas City, and he wears a couple of different hats. He works for Four Seasons. He opens up. What he does now is he is the guy that opens up a new Four Seasons hotel. So if you can open up a new Four Seasons hotel like he did this year in Philadelphia, Todd goes there. He trains the staff. He hires the staff. He teaches them the culture, because a lot goes into it. And actually, matter of fact, I think his hotel was voted one of the top 5 in the world right after he opened it. It's currently closed because of the pandemic. He also wears a hat in the healthcare industry, and that's an area where, he and I sort of converge. I mean, I'm very much into hospitality, and I'm very much into healthcare, and I come from the healthcare side. He comes from the hospitality side and goes into healthcare. And so he and I have a lot to talk about, and we've been working together and sharing information. And he's sort of he's offered to become a mentor to me, which I appreciate. He will be coming this Christmas, December 4th. He'll be coming to the Marriott Hotel in Trumbull, where we're going to open that up to the whole community. Dentists and their teams, their staffs, and everything can come. So if you like what he has to say today, you can come back and you can spend a whole day with them on that day. So as we do each week, what I like to do is I like to introduce, where I think we are at as a dental community, where I'm at. I synthesize what I hear from the news. There's not that much science behind what I have to say, because there is not much science about what's going on with COVID right now. I mean, we have more questions than answers. And they say that there are 3 levels of information. And the first one is we know what we know. So like I know how to ride a bicycle. Okay, I know how to get on and pedal it, etc. And then you know what you don't know. I don't know how to fly a jet airplane. So if I go into a jet airplane, you ask me to fly it, no idea. But then there's a whole other area of knowledge. It's like what we don't know, we don't know. And that's what's going to come out of this crisis. We don't know what's going to come out of this crisis. An example, earlier in this year, we did not know that the pandemic was going to be hit and that we would spend at least 2 months sitting behind our desk in the computer. We had no idea that this was going to happen. Similarly, we don't know what's going to happen in the future. We can't predict all of that. So, and probably what's going to happen in the future are some really good things that we have no idea what they are. One of them, like so far, I mean, I didn't know how to run a Zoom meeting. I didn't know how to sign up for Zoom. So that's something that I've learned, as you all have too. I mean, a few weeks ago, the first time I ran a Zoom meeting with all of you, just a few of you that were on that meeting, I didn't mute anybody, so we're all talking the whole time. It was a little confusing. So now I know how to run that, as you all probably do as well. So where are we right now? Schools are closed for the duration of the year. We don't know when they're going to open. Maybe September, maybe earlier, but we're not sure. There's no decision on summer camps. That affects us as dentists because a lot of our staff rely on summer camps and school to take care of the kids during the day so they come to work. What about dentistry? Can we go back to work? I don't know. I mean, no one said we couldn't go to work. That's the reality. There was a recommendation that we not work until May 20th by the governor of Connecticut, but he didn't say we couldn't work. A couple of people aren't muted. If you can just mute yourself, there's some background noise. I'd appreciate that. Actually, I found one right there. There's one. So what about dentistry? Governor Lamont was on the radio, and some of you saw this, and I've already gotten a bunch of emails about that, and I listened to the radio interview in preparation for this. It was a 18-minute interview. He says that we're going to open up in phase 1, 2, 3, and 4. What does that mean? I don't know. Phase 1 is May 20th. Phase 4, I don't know what that means. He's figuring out these phases because he's figuring out. He's not a scientist. And during it, he says that phase 1 is going to be restaurants, offices, hair salons, and barbershops and retail stores, outdoor museums and zoos. And then someone asked him about dentistry. He goes, well, you know, first of all, he said, we can open this dentistry because it's elective. And they said, well, maybe that's a phase 4. Well, the reality is the chance of getting the disease in a small environment like a restaurant is significantly greater than in a dental office. And if you have the disease and you're sitting around a table with somebody else that doesn't have the disease, the chance of them getting it are pretty high. In the dental office, we're going to be covered with PPE protection. The chances of dentists getting it in the office or our staff or our team or assistants is actually relatively low. We looked at that data last week. 0.02% in Wuhan, and the same data was in Indonesia. 0.02% of the dentists that were wearing normal standard protective clothing, not the N95s and not with shields, they only got it about 0.02%, very low. So now I talked about the 3 different levels of, you know, information that we have. You know, we know, we don't know, and we don't know, we don't know. There's also 4 levels of understanding. The first level is data. Okay, those are the numbers. Those are things that we look at. Like it's 76 degrees today. Tomorrow it's 74 degrees. That's data. But then we look at a trend. Well, it's becoming summer. The trend is it's getting warmer each day. So I guess it's getting warmer. We must be moving into summer. That's a trend. The knowledge is the 3rd level, which is based upon trends. Once you have knowledge, then you're sort of an expert. But then there's another level. And that other level depends not only data and trends and knowledge, it's called wisdom. And there's certain things that I know as a periodontist, because I've been doing this for 40 years, that aren't really based upon a lot of data and trends. It's based upon the wisdom of doing this for 40 years. Currently, putting into perspective, currently we have no data about this pandemic. We're at the lowest level. I'm getting emails today from friends saying everybody should be tested before they come in. Well, I don't know if that's true or not. Why should everybody be tested when we have a 30% false negative? And if you are positive for the disease, you may not test positive for it for 3 days or actually 12 days. A better test would be the antibody test, because that's 99% accurate that the disease has been in your body. But that doesn't mean that you can't pass the disease on. It only knows that it's been there. I think the importance of testing is it gives us trends so we can get to some knowledge about what's happening. But is it going to give us protection? We don't know. I mean, you go into Whole Foods, you got to stand 6 to 8 feet apart. You all have to wear a mask and only allow 50 people in there. That's probably overkill, because most people are not going to get the disease in Whole Foods. You know where most people get this disease? Where you're sitting right now in your own home. Most people get it from a family member that got it on the outside. It's in close proximity, because to get the disease, you need to have contact time in a certain dose, and you have a lot of contact time with your family members. When I see joggers run by with masks, or people driving in a car by themselves with a mask, that makes no sense. So what do we have? What do we have? We have no information, or very lack of it, and people trying to say, what mask do I wear? I got a call today, what mask do I wear? Can I wear the KN95s because I can't get the N95s and are they counterfeit? We don't have data that the KN95s or the N95s are more effective than our level 3 masks in fighting influenza. We don't have that data for COVID yet. So we have a lack of information, and that we also have another crisis. We have a lack of leadership, because the leaders are using the information, they're polarizing it. We're polarizing it politically and for financially. And the companies that sell us this stuff are doing the same thing too. What kind of respirators do we need? What kind of air purifiers do we need? I'm using this one. I'm using this one. This one has UV. This one has ozone. Nobody really knows. So what happens is we have a void, and in that void we have confusion and we have fear. Yeah, we have a pandemic, but we really have a fear-demic. And this is fueled by partisan politics and the news media, which loves this. This is great. Nothing's better than news media than a crisis. I'm going to flip that around, or actually Todd's going to flip that around at the end. He's going to say nothing is better than, nothing is better to be entrepreneurial than a crisis, because that's where all the opportunities are going to come. So we're going to get positive about this. So yes, we need more testing. It would be nice to see some trends. Governor Lamont says we plan on testing 100,000 people a week. We will see. I don't know if that's going to happen or not. We have over 3 million people in Connecticut. Do we have enough tests for that to happen? Now, last week I shared some data on influenza and COVID. Okay, influenza in 2018 and 2019, there were 1 billion cases, okay? And 56 million in the United States. So please mute yourself, whoever is unmuted. So that's for a full year. And COVID, people criticized me. I said, well, COVID has 3.5 million cases compared to 1 billion, but it's only over a few months, and that's true. The pace of COVID is increasing faster than the pace of influenza. That is true. And from last week to this week, we increased worldwide cases by 14%. We went from 248,000 deaths worldwide, 248,000, a quarter of a million, to 280,000 this week, an increase in 13%. The United States has over 1.35 million cases, almost 1.4 million. Okay, death rate has increased 17% in the United States in the last week, and cases have gone up 14%. So that's what we're looking at. But how do you look at the numbers? We have 3.5 million people in Connecticut, 300.5 in Connecticut. We're in Fairfield County. Well, most of us are in Fairfield County, so I'm going to speak to that. We have a little less than a million, about 950,000 people in Fairfield County. We have 2,800 deaths in Connecticut. We had 950 deaths in Fairfield County with a population of 1 million, okay? So what's the death rate in Fairfield County? The chances of you dying from COVID in Fairfield County are 1 out of 100,000, or 0.001%. It's really low. And most of the people who die are elderly. Most of the people who die have diabetes. Most of them are hypertensive. Most of them have more than one comorbidity. Pennsylvania just released this data about 3 days ago. The average death rate in Pennsylvania, you know what it was for COVID? 79. And 67% of the people who died in Pennsylvania were in nursing homes. It is happening. It is severe, but it's probably not going to affect young and healthy people. So if you're young and healthy, the chances of dying are less. What we're seeing now in the United States is an aberration because we only have 4% of the world's population, but we got 34% of the disease. 1/3 of the cases of COVID are in the United States, but we only have 4% of the population. We have 8 times more cases than we should based upon international averages. And I don't know why. Nobody knows why that's happening. So the death rate, if you do get the disease, we think it's about 0.1%. We look at higher numbers because we're only looking at the number of people who've been tested. But if we test everybody and then look at the death rate, it's going to be much lower. And most of the death rates that were contributing to COVID may also be due to respiratory disease or cardiovascular disease or other things that may have killed the patients anyway. Let's look at another bit of number. Now, I'm not really a numbers guy, but I decided I'd look at the numbers because we tend to be attracted to numbers as human beings. 6,000 people die an hour in the world. 6,000 people die an hour, 151,000 a day, and 60 million people a year. So 60 million people are going to die a year, independent of COVID. Heart disease kills 18 million, cancer 10 million, 6.5 million due to respiratory diseases, and 1.5 million due to road accidents, 1 million due to HIV, which I found surprising that many people are still dying of HIV. So we lose over 1 million people with HIV a year. And suicides, you know how many people die of suicides? Almost 1 million. We have 800,000 suicides a year. That can be prevented. Thus far, COVID is 280,000. It pales compared to the other diseases. It's 0.0046% of the deaths. More people die from suicide and AIDS than COVID. Now, I looked at another number. I looked at the trends, and I looked at the trends of deaths. February 1st, 2020, nobody died in the United States. February 8th was our first reported death. 1 person died. February 15th, a week later, nobody died. February 22nd, our second death was reported. A week later, 7 deaths. March 7th, 1 month after the first reported death, 29 people died. You move ahead another month to April 4th, over 8,000 people died. And then we peaked on April 11th, was the peak nationally. 13,000 people died. April 18th, 12,000 people died that week. And
anyway,
I'm muting this guy, okay? And on April 25th, 7,000. On May 2nd, the week before that, 1,600 people. I do not have the data for last week, but the trend is it's dropping precipitously. So we passed our peak in the United States. So complicating matters, there's an indirect effect of COVID on the world. It's both positive and negative. Now, Francis Janame of the Hugo Observatory argued that the death toll of coronavirus at the end of the day might be positive if you consider the deaths from atmospheric pollution. During the lockdown in China, emissions fell significantly. And using conservative estimates, Marshall Burke from Stanford University said that lives saved due to pollution reductions are roughly 20 times the number of lives that were directly lost to the virus. So the virus could be a good thing because it keeps us in and we're decreasing pollution. The overburden of the healthcare system is going to create more suffering for people that can't get emergency care. as well as reducing the economic foundation of the United States, meaning that there's going to be an increase in stress. People who need urgent care are not going to get it, and there may be an increase in depression, which may be an increase in suicides. Now, personal story. Yesterday, a very good friend of mine and I went for a walk. My friend is a type 1 diabetic. He's 50 years old. During the walk, his sugar monitor was going off. His sugar was dropping. And the day before, he was on a long walk and he passed out and had to crawl to the car and take some sugar pills. I said, you got to get that looked at. I mean, I think you really, because he's been exercising a lot. So it's a guy that's really been somewhat sedentary and is walking. I mean, he's going crazy. He's walking 4 to 5 hours a day. 4 to 5 hours a day he's walking, and what happened is, if you all can just mute yourself, please. I'm going to mute you all. Sorry, you muted you all. So let's see. 1 second, guys. No, I can't mute somebody for some reason. Anyway, my friend that I was walking with yesterday called me last night. He called me from a hospital bed. He passed out due to hypoglycemia on the way home, crashed his car, walked into a Starbucks angry, and they called an ambulance and took him to the hospital. So here he is, in insulin shock, hypoglycemia, and he was released within 2 or 3 hours. It would have kept him overnight for observation if it wasn't for COVID. Now, he went home after probably suffering a concussion because his face was all banged up. They had to get him out of the hospital fast because he's a type 1 diabetic. What if he died at home that night? He didn't. He's okay. I spoke to him a few hours ago. He didn't. But those are the kind of stories that we're going to be hearing post-disease. This disease is really creating more chaos than we really know for people that really need care. Unemployment is increasing. We all see that. But it's also increasing? We have a hunger crisis. 70% of the people in this country, poor children, are not getting enough food. They may end up starving to death. But we have tremendous amount of information. We have 2,500 articles were published this year on coronavirus alone, but we have less knowledge. There may be a second wave coming. And still, I just read this morning, and as you probably did, that nightclubs, because there's now another spike going on there. My partner, Dr. Ma, he'll probably share this later, said this is now maybe a spike going on in China. I don't have all the information on that. So right now we have over 80,000 deaths in the United States. It's predicted we're going to probably have 130 to 140,000 by early August. It's a pandemic. But pandemics work Darwinian. The stronger and the healthier, and more intelligent are going to survive. But it's not always the fittest or the strongest. It's the most adaptable that survive, not just the fittest or the strongest. And our office is going to follow the recommendations of the ADA and the CDC. However, the ADA and the CDC aren't in sync. So the CDC's recommendations are a little bit older than the ADA's. Dr. Redfield, the president of the American Dental Association, wrote to the CDC on behalf of our members. We asked for the CDC and prevention to quickly provide guidance on how to safely reopen. We have not received that information back. So the CDC guidelines are a few weeks old, but this disease is changing daily. So what is the risk to our patients? What risk do we have to our patients? Well, we don't know because we don't have that data. It really hasn't been published. We don't have data of transmission from dental aerosols to patients or to dentists. In Indonesia, the risk to dentists, as I said, was low. It's less than 0.01%. And the same was true in Wuhan. So probably it's recommended that cosmetic dentistry not be done for the time being. Nothing that generates any aerosol, if possible, for the time being. And I'm not going to go over the PPP. We did that last week. But what about patient confidence? We're patients. I know my patients that call me want to come back. Northeast Dental did a survey, and they found 60% of the patients said they'd go back to the offices if they're open today. 20% said no, not today. In 3 months, they said, when they asked again, would you go back in 3 months? 80% said yes. So what does that mean? We're going to be doing less practice production, obviously, this year, but we'll probably get back within a year, assuming that there's not another spike in the disease or another catastrophe. Americans want to return to work, perhaps say some too early, perhaps say it's time. Nobody really knows. But there are other problems if we don't go back to work. So I recommend that there are 4 levels of information, right? Data, trends, knowledge, wisdom. We don't have the wisdom yet because we don't even have the data. So it's a crapshoot. So what do we do? What do we know? What don't we know? What do we know? What we know is this. We know people are sick. We know the economy is in a tank. We know businesses are closed. We know the stock market dropped, but recouped 50% of its loss since March. We know that we're getting pretty good at using Zoom meetings and the technology. Are antibodies tests useful? Well, yes, they're only useful for telling if you had the disease. It doesn't tell you that you're immune to the disease or you don't carry it anymore or you can't pass it on. We don't know that yet. Are antigen tests useful? Well, I think it might be a good idea if we all had an antigen test so we could say to our patients, I tested negative. I may be positive, but I tested negative. Patients don't know that. So optics may be important. What about a vaccine? Johnson & Johnson says they're going to roll out 1 billion vaccines next year, and some are going to be available this year. Well, I wish I knew that before the market opened today. They're probably going to go right up. That's what they announced. But they announced it. That doesn't mean it's there. Who knows if it's going to happen or not happen? But probably we'll have a vaccine next year. The future impact is going to be both positive and negative. Okay. Now, what can we do? And, you know, we can maintain a positive mindset. We have to be leaders. We can forget about ourselves and focus on others. We can focus on what we can do, not what we can't do. We can forget about our commodity as our dentist, forget about the dentistry and focus on relationships with our patients and with our staff members, with our teams. You know, Ray and I have been doing that with Zoom meetings with staff members on a weekly basis, sometimes twice a week, and with our patients as well. We want to be able to create as much value as possible. So when patients come back, they can say, you know, this office is really going over the top. This is special. The really, really great offices and businesses are going to prosper. This is a time to differentiate yourself. Don't worry about today's losses. They're short term, but the opportunities are going to be long term. There's going to be a tremendous number of opportunities in the future. We can't control the future. We have to ignore what the experts are saying. The experts are usually wrong. If the experts were so great, they'd stop talking and they start doing. You know, when someone says, well, I got a good, my stock experts, they're experts. They just be making money in the market. Warren Buffett doesn't come to me and say, hey, you know, Mike, this is what you should be doing. He's doing his own thing. He's not sharing that information after he's done it. Now, Simon Sinek, who we talked about before, he talks about, you know, the who, what's, and hows, you know, and he talks about, you know, your why. You know, why did you become a dentist? Why are you going to work every day? Let's get back to the why, not the hows. We have to do the hows and the whats. We got to figure out some personal protection equipment. Got to figure out how to make our patients safe. But if you become the why, I am here for you. I'm here to make you as healthy as possible. I'm here to take care of you in your need, because patients do need to be taken care of. Create a first-class practice that patients want to come home to because they want to feel safe, they want to feel protected, they want to feel loved, they want to feel nourished. Create a safe environment. Don't come back too fast. Come back slowly. Test it out. Test it out with your staff. This Sunday, we're going to have our entire team in the office practicing, making believe that we're seeing patients. And we'll do it a few times until people are comfortable. And if they're not comfortable, they don't have to come back. I'm comfortable enough coming back because I think I'm not going to get the virus from my patients. And I have to be there because there's so many emergencies. So with that opportunity that we have, I'd like to introduce Todd Williams, and who I partially introduced before. But Todd is a speaker and consultant. He has worked for Four Seasons Hotels. He has a tremendous amount of information from the hospitality industry. He's focused on relationships. He's focused on love. He's focusing on connection. And he's a great speaker, mentor, and his hotels do great. He works for probably the best hotel chain in the world. So with nothing further to do, I'd like to introduce Todd, and Todd will end up speaking to us for a few minutes. Thank you.